Here is some great information on the West Nile virus and how you and your family can protect yourself with the Acton Nursing Services.
Hi, I'm Cheryl from the town of Acton, and I'm the health director. And we're here today to discuss West Nile virus, how you can protect your family as well as treatment and diagnosis. We have a contract with Central Mass Mosquito Control Project. As part of that contract, Central Mass routinely tests mosquitoes, and those tests are sent to the Mass Department of Public Health. And we have had, unfortunately, 3 mosquitoes that have tested positive for West Nile. So because of that, we had the first one in July, and that was in the Simon Willard area. We conducted a town-wide spraying of the certain area, a radius of the certain area that was affected. And that happened in July. And then just recently in September, we had 2 additional mosquitoes test positive. One was on Spencer Road and one was at the Maynard Town Line. So we also did another targeted area spraying. And the reason for that was to minimize the impacts it would have to you as the residents. So if you can recall, back in 2000 to 2008, the Mass Department of Public Health was testing birds. We were finding dead birds on the sides of the road, and that's the point that we realized that West Nile was here. So the Department of Public Health tested those birds for those 8 years, and they determined that indeed it was here. And now I'm going to have Heather talk about the health impacts.
Thank you, Cheryl. So the symptoms of West Nile are pretty common to a typical virus or a flu. 8 out of 10 people infected with West Nile don't develop any symptoms, so a lot of times people don't realize that they have it. The most typical common symptoms are a febrile illness. 1 in 5 will typically have those symptoms that include a fever, with other symptoms such as a headache, body aches, joint pain, vomiting, diarrhea, or a rash. Most people recover pretty quickly and completely, but sometimes fatigue and weakness can last for weeks to months. There are some serious side effects for some people. It's very rare though. That includes a very high fever, headache, neck stiffness, disorientation, coma, tremors, convulsions, muscle weakness, vision loss, numbness, and paralysis. So those are things that definitely you need to see a practitioner for. West Nile can happen in any age, but the 60 and above group are at greater risk. And then those with certain medical conditions, diabetes, cancer, hypertension, kidney disease, and those who have received any kind of organ transplant are at greater risk for having a reaction to a mosquito bite. Those who do get a severe illness, it can take weeks to months to recover. Some of the effects of the central nervous system are really what is the biggest problem. So again, if you have any of these symptoms, you should definitely contact your healthcare provider. The diagnosis of West Nile is the West Nile virus antibody testing, which is collected with a blood sample or also from cerebral spinal fluid. The disease is typically detectable 3 to 8 days after the onset of symptoms and can persist for 30 to 90 days. Viral cultures can be taken from blood, spinal fluid, or tissue to also confirm the infection. So that's how it is diagnosed. The treatment for this is really over-the-counter medications. There's no vaccine. There's no antiviral medications for West Nile. The over-the-counter pain medications can be used like a Tylenol for fever reduction and to relieve some of the symptoms of joint pain and headache and things like that. In severe cases, typically a patient will be admitted to the hospital mainly for supportive treatment, for dehydration, giving some IV fluids, maybe if the pain from joint or headache is severe enough to warrant something a little stronger than an over-the-counter medication, and then just for nursing care and oversight.
So all this information that we spoke about today, there's a lot of great resources I'd like to point out to you. The CDC has a great website, which is the Center for Disease Control. Mass.gov has public health fact sheets that could be of interest to you. And also the Central Mass Mosquito Control Project, they have a great website with a lot of information on it, and I would highly recommend that you look at that. And you can also call Central Mass, and their phone number is 508-393-3055.